The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Thank you for joining the DFSS shelter webinar that is focused on our strategy heading into winter. I'm Maura McCauley. I'm the Deputy Commissioner for Homeless and Domestic Violence Programs at DFSS. Many of our homeless and DV team members are also on listening in. Today's webinar will focus on an exciting new partnership that DFSS and CDPH are working on with a number of medical health providers, really building off of the organic partnerships that evolved during the pandemic leading up until now. So we will have Mary Kate Schroeder from CDPH joining us and a few of our health partners to introduce themselves. That will be the first about 15 minutes of the webinar. The remainder of the webinar is really geared towards DFSS shelter delegates to talk a little bit about some housekeeping issues and things that we need to be paying attention to in terms of helping people get matched to shelter during this winter month, these winter months. And then when we scheduled this webinar, we had no idea the direction that the pandemic would be going. And you know, I think everyone is on high alert as we learned, you know, that there is a new stay-at-home advisory that the mayor issued and the governor issued yesterday. And so some of our medical partners from CDPH will be also joining us to talk about what that means and how to really, you know, make sure that we care for each other and our staff and our residents during these times and taking appropriate preventative measures. So a little bit of housekeeping before I hand it off. If you have questions or any technical issues, please put them into the question box. We will pause for questions after the shelter-based service piece ends, and then we'll pause again at the end of the webinar. So thank you so much for joining us. And at this point, I will hand it off to Mary Kate Schroeder from CDPH to talk about the Shelter-Based Services Initiative. You can go to the next slide.
Hi, Mara. Mary Kate, you are unmuted. So this is Tom Mose from DFSS, just helping out with technical assistance. And I just heard your voice, so you can go ahead.
Thank you. Hi, everyone. Excited to be here and to kick off this work together. My name is Mary Kate Schroeder. I joined CDPH, the project manager for shelter-based service teams, a month ago. And if some of you might remember, I was formerly at DFSS and started a year ago leading a pilot for interim family shelters and workforce programs, which unfortunately was paused due to COVID. But I'm very excited to be continuing in this space and able to offer a resource that is helpful to shelters. So next slide, please. Oh, back one, Carrie. Sorry, can you go back one more? Thanks. So shelter-based service teams were born out of the COVID-19 pandemic, which we know has shown a brighter light on the inequities that people who are experiencing homelessness face. And so we know that long-term care and infrastructure was needed, and we're really excited to announce this initiative to help support the infrastructure for primary care, behavioral health, and infection control services in shelters. And so each shelter-based team will be supervised by a lead coordinating organization. So by now, all of you should have received an email from me introducing you to your LCO, which is either Lawndale Christian Health Center or Heartland Health Alliance. And in a few slides, they're going to introduce themselves, and there will be emails up on the screen on how to contact them. So you can reach out to them directly at this point. You can go ahead to the next slide. Slide 4, Carrie. Oh.
Is this the slide you want, Mary
There's a
Kate?
bit of a delay. I'm going to, just for the sake of time. So the goals of shelter-based service teams are, in the short term, we'd like to reduce transmission of COVID and other diseases in shelters, and this means mitigating the severity of COVID-19 amongst residents of shelters and containing outbreaks. But in the long term, our goals are to improve the health of people experiencing homelessness, and we hope to do so by creating these sustainable networks of healthcare providers that are delivering culturally responsive and trauma-informed care. I'm really excited about these two partners, Lawndale and Heartland, because they already do this work, and so it just feels like we're kind of all coming together in a way that will hopefully build this network for the long haul. Next slide, please.
I'm already there.
Oh, sorry. I have a bit of lag, I guess, on my end. So the roles of shelter-based service teams have 3 prongs. So the first one is infection control to slow the spread of COVID. So this means helping build capacity within shelters to implement the local and national guidance to reduce the risk of COVID-19 transmission. This can include working with shelter staff to figure out ways on how we can make changes to the facilities to improve social distancing. It also means helping you all identify clients that are higher risk for some of the accelerated moving events that have already started in shelters as part of the expedited housing initiative that's being led by All Chicago. And we also have the Buy Next Now testing that's become available, and we're starting to roll that out. And so shelter-based service teams are a great resource for you all to lean on for best practices in using this testing and training for your shelters. The second prong is primary care. And so we want every shelter resident to have the opportunity to have a face-to-face visit with a primary care provider. And this is especially important this season because we would like to strongly encourage that everyone in shelters get a flu vaccine, both staff and residents, and primary care providers can help not only give the vaccine, but also answer questions from staff and from residents on why they need a vaccine and the risks and rewards of that. And I will just say this is a special season and a really critical time to get a flu vaccine. And so we want to strongly encourage those conversations to be happening in shelters, and your LCOs are starting to try to tap into staff meetings and other opportunities to broadly communicate with staff on this. And then finally, the health and safety of staff is extremely important right now. And so as you all see fit, we can also extend the opportunity for staff to receive primary care as needed from our shelter-based service teams. And then finally, the third prong is behavioral health. And so this will include things like providing psychiatric assessments and medication management, providing MAT for opioid treatment and other substance use disorders, and then brief intervention services, including things like solution-focused therapy, motivational interviewing, cognitive behavioral therapy. And this is one of the more exciting things, I think, in this initiative because I recall from my site visits to shelters in my last role, mental health was on the forefront of folks' minds. And it's very exciting to see that we're able to build this infrastructure to be on site in shelters. All that to say, shelter-based service teams are intended to layer on to existing healthcare partnerships. So our goal is not to disrupt the partnerships that you all have worked hard to cultivate over the years. So I can imagine this looking like, you know, maybe you have a primary care provider in your shelters already. And in that case, we could support you in infection control, for example, or, you know, disseminating Binax now and helping you figure out how to test in shelters, things like that. You can go ahead to the next slide. So now that I have talked for quite a few minutes, I'm going to turn it over to the Heartland Alliance Health team to introduce themselves. They can turn it over after to Lawndale Christian Health Center to introduce their team. And then we'll give the floor back to Maura to talk through how we imagine engagement between shelters and shelter-based service teams. So thank you.
And Tom, Katie Kelligan from Heartland Alliance Health will be introducing.
Okay, Katie, you want me to, Katie Callaghan, you said?
Yes.
Okay, she's unmuted.
Okay, hi there, everybody. Yeah, my name is Katie Callaghan, and I am serving as the administrative point of contact for Heartland Alliance Health, our lead coordinating organization, as the contact, your first point of contact. Our team, our shelter-based services team, is covering the northwest, central, south, and far south regions of the city. Our team is led by Mary Tornabene, who is a family nurse practitioner and has actually been leading this type of work for Heartland Alliance Health for over 30 years. So we're very excited to continue being supportive of Mary's leadership here. And then each of the regions will have their own assigned community health nurse. Many of you have already met our team. Greg Bowman, community health nurse, is assigned to the northwest region. Sam Long is the community health nurse who will be working in the central region. And Jade Greer has recently joined our team as the manager of outreach and testing. And she and I together will be covering the south region until we can hire on our community health nurse who will be assigned to that region of the city. And I'll stop talking there. If there's time, I would love to turn it over to Mary, as she's the project lead, to offer any comments about the work. Thank you.
Okay, Mara, who should I unmute next? I'm sorry.
Mary?
I'm sorry, you cut out.
Mary Tornabene, if she wants to give a brief welcome, and then we'll turn it over to Dr. Wayne Detmer.
Muted.
Hello, can you hear me? As a LCO and SBST, Heartland Alliance Health is very excited to strengthen your relationships with your existing health partners, augment your services where needed, really work with your staff and participants around comprehensive care, enhance infection control through primary care, behavioral health, substance use treatment, also assisting with housing, benefits enrollment, dental services, you're strengthening infection control practices, and really working with disease prevention and vaccination. We're really looking forward to our conversations with you, and please do reach out, sheltercare@heartlandalliance.org if you need any assistance. Thank you. Dr. Detmer?
Hi, this is Wayne Detmer from Lawndale Christian Health Center. We are very, very excited to be a part of this initiative, and I think I want to just say for the record that we do not see ourselves as taking the lead on some of this stuff, but we want to be listening to our shelter partners, and we want to be supporting you in your needs. And so please feel free to always reach out to us. And I know Heartland feels the same way. We're here to support the city and to support the shelter partners who are doing such great work. I also want to say that we are very, very blessed to be able to work with such great partners as that we have at Heartland Health Alliance, and both of our organizations are working together so that we're providing consistent quality services across all shelter sites. I'm going to introduce Dr. Tom Huggett, who's our medical director for this project, and allow him some minutes to share sort of our vision and view.
Hello, this is Tom Huggett. I'm a family doctor working at Lawndale Christian Health Center, and I'm blessed to be also part of a team that has provided healthcare for folks experiencing homelessness on the west side for the last 25, 30 years. So we know we've been working with many of you already on the west side. Some of you we've not been working as closely, but we hope to really strengthen what we can do for primary care behavioral health in particular. What we showed at our what we showed during our work at the hotel downtown is that we could really, by working together, doing primary care, strengthening behavioral health, and getting people their benefits and working with our housing partners, we can really achieve the goals of achieving housing. So we serve 259 people at the hotel, and 133 are now in housing. So that really is a goal that we want to work with your care managers as we move forward. And I would like to really kind of emphasize what Mary Kate already said, is that we would love to see all of the folks that you serve in your shelters at least once, even if they've seen even if they're seeing a primary care doctor somewhere else. So thank you for that, and I'll turn it back over to our city partners. You can see Caroline Kuhl is also our administrative director, so she'll be involved with many of the emails and setting up meetings and setting up things like that. So we'll be coming out to the shelter sites, of course, for trainings. Caroline will be very involved with setting up some of the administrative things and delivering supplies and other things. But our email is also on the screen. Thank you very much.
Thank you so much to Lawndale Christian Health Center and to Heartland Alliance Health. And really thank you to CDPH for being such a deep partner with all of us during this pandemic. And I think to all of our shelter and service providers for really lifting up the value and the need for such a partnership. It was very clear, it has been very clear to us as we've all been working in different ways together. And so before I move into the next slide, there is one, you can move to the next slide, but I do want to pause for a question that's in the chat for, I'm going to turn it over to Mary Kate, but the question is, will these services be limited to shelters, or will they be extended to permanent supportive housing programs that provide supportive services that are funded by DFSS? Mary Kate, do you respond?
Yeah, so we want to prioritize this care in shelters first and foremost. And so since we're just getting started, I think it's right to say we're primarily focused on shelters. The purpose here is making sure that people who will otherwise not have access to health care are able to get it. And so I hope that helps answer your question and reiterates why we're focusing on shelters to start with.
Thanks. Okay, so again, we're very excited about this partnership, but as we're rolling it out at the shelter level, did want to take this opportunity to pause today to solicit some best practices from the community on how we can maximize this opportunity. The shelter-based service teams are an opportunity for the shelter programs to better meet your clients' needs and improve the safety of your facilities for your residents and your staff. And your shelter leadership and staff play such a critical role in facilitating those opportunities and building that trust with people coming in to provide services. And so we know that many of you have already begun working with the shelter-based service teams and have previously worked with healthcare partners. So we're really interested to hear from you in the chat, in the question box, what you're thinking about now as a program, or what advice you would give to other shelter programs. we're specifically wanting to know, around communicating this opportunity with staff and residents. What are good ways that you found to introduce a health partner to residents? What can shelter staff do to build trust? Please type any thoughts into the question box and we'll share that out. And then again, what has your shelter program done, or what are you planning to do to support healthcare partnerships? Things like sharing a census of current residents with the medical teams, making time at staff meetings for introductions, making sure they have a primary and secondary contact with your program. Any thoughts that come to mind that have been helpful or you'd be thinking about would be helpful, take some time and enter that into the chat. And I think this will help us guide, future conversations and provide feedback to the medical partners as they move forward. I'm just going to pause for a few minutes to see what comes in. So I'm seeing, that it's important for the service partners to know that some shelters are in the same building as other congregate programs and supportive housing. There's overlap around meal service and programming, so really thinking about scheduling and the use of space, it sounds like, will be important to know. Natalie Hill is sharing from Northside Housing that they've had healthcare partners meeting with staff and presenting at community meetings with participants. Suggestions that small incentives are a great way to break the ice. There's some questions, and we're going to talk a little bit about what this stay at home advisory means, about how services will be accessed. Andy from Lincoln Park is talking about it's been really useful to turn the guidance into operational solutions for the team who's operating the shelter. Katrina Coleman is sharing that consistency is really important in gaining trust. So we're seeing a lot of great feedback, as I knew we would. Thank you. I don't want to take up all of the time going through these, but we will definitely compile them and share out when we share out the webinar with all of you. So thank you, as always, for providing your insight. And I think that's exactly what the shelter-based service teams are looking for. So let's move on to the next slide. We're going to move on to talk about bed availability in the shelter system and expectations for DFSS funded shelters as we head into the winter. So non-DFSS funded shelters, you can drop off at this point or any point, but you're also more than welcome to stay on and listen in. Okay, so we wanted to really start off with an update on where we are with beds in our system. As you know, DFSS has been following the public health guidance and advising and supporting shelters in operating at reduced bed capacity to allow for safe social distancing. Prior to COVID, DFSS supported a little over 3,300 beds in our shelter system. Following decompression, we're currently at about 22,545 beds in our system, plus 400 beds that DFSS and our partners have stood up at 2 alternate shelter facilities that are currently operating at Young Women's Leadership Academy for women and families, and then Calumet High School for single adults. So you can see that we saw the largest decrease in beds for single adults, where a larger portion of our shelters were congregate spaces. And we're really sharing this with you to also share out, I'll move on to talk about strategies that we're using to continue to add beds back into the system, but really wanting to be very transparent because we all have this shared accountability in helping people access the beds that are available. And we'll talk in a bit about, making sure everyone is aware of your bed availability, but wanted to really give you this picture about where we're at for that purpose and just where we're heading and what we're thinking about. So our current bed picture does look better. You can go to the next slide. Than it did in the spring and summer, really thanks to the creativity and commitment of people on the call today. Since the beginning of the crisis, so many shelters who originally needed to reduce beds at the beginning have been able to creatively use space and improve infection control practices, do things like install dividers and similar improvements to bring back some of the bed capacity at their locations. And as we head into winter, we want to make sure that we have identified all of the opportunities for any additional beds in our existing system. So as you've heard and as some of you have experienced already, the shelter-based service teams will be working with you to identify opportunities for one-time infection control improvements in your facilities. DFSS is partnering with the shelter-based service teams to also use this opportunity to elevate and formalize any opportunities that you might have for one-time costs that would help you safely expand bed capacity. And if you move into the next slide, I'll give you a little bit of a specific. These are the specific questions that are on the assessments that the shelter-based service teams are looking at, and they will be sharing with us. And we'll be taking a look at those for potential mini grants through CARES Act funding. So we're really interested if there's any modifications that could allow you to add beds safely, things like putting in dividers or minor renovations that would help you adjust the layout for bed spacing, converting unused spaces to a more livable space, different beds that could help support head-to-toe arrangements. And again, minor renovations like the addition of bathrooms or showers. We'll be looking for the approximate costs and also the proposed number of beds that you think this might allow for. So again, you can work on these questions with your lead coordinating organization for your shelter-based service teams. And some of you have already reached out to DFSS to let us know that you're thinking about these things. So this is really how we are going to be operationalizing that opportunity. So please communicate with them about any opportunities that you see or you're interested in exploring so they can take a look at the infection control side of things and help get that information to us. And you can also always feel free to reach out to me or anyone on the DFSS team if there's something that you're considering. I'm going to move on to the next slide. So we also want to give you updates on what we are doing to pursue opportunities to retain bed capacity in our system. So we have continued all throughout this pandemic to do our best to remain as close to our pre-COVID bed levels. So we will be continuing operation at the alternate shelters through at least March of 2021. We are also working closely with All Chicago and all of you and housing partners in the community to make sure that the Expedited Housing Initiative houses those who are in shelter as one of the target groups for EHI to free up space for those in crisis. So we're improving our flow through the shelter system. This week we released an opportunity for our domestic violence shelters to expand by managing hotel vouchers for approximately 50 beds for DV survivors. We are funding an opportunity from a shelter who is moving facilities to add beds into our system by retaining their original space for another year. So just a temporary solution that helps us keep beds in the system or bring beds back. We are also working to identify and fund a hotel option that would be used in coordination with the Expedited Housing Initiative, looking to support shielding of high-risk residents, and again, to support the flow to housing. So that could be anywhere between 100 and 200 beds. And then DFSS has been working really closely with the Department of Housing and the Department of Public Health to pursue options, for a short-term investment that could serve as an emergency shelter now and then become supportive housing in the future. So I wouldn't say that's an immediate option, but just want folks to know that that is something that is being explored as one of the strategies. So while we are currently experiencing a gap in our beds, the number of beds in the system is pretty constantly fluid. And again, really see your leadership and any vision that you have for what could help you bring back beds safely as one of the really important solutions. So wanted to really share that with all of you as we're heading into the winter. So within the context of this, shift in bed availability, I also wanted to just take this opportunity to talk about, several key expectations that we have of our shelter providers as we are heading into the colder weather and a second wave of cases. So we'll just talk through some of these slides at this point in time. You can move to the next slide. So it's going to be really important for DFSS to know in advance if you will be taking beds offline. We've had shelters, we understand that beds do need to be taken offline for different reasons, like scheduled maintenance. If you have emergency repairs, that does happen in all of your facilities. If you're having issues with the landlords or facility providers, just please let us know in advance so that we are aware of any change in capacity to our system, and that can get communicated to Catholic Charities as they're managing the bed availability in real time. Next slide. Also, just reiterating the request to communicate with Catholic Charities in real time. Please make sure that all of your shelter staff who are answering the phones, who are the contact for Catholic Charities, have a real-time understanding of your bed occupancy and can provide that to Catholic Charities, when they call. If that's not possible, please work with Christy Richardson at Catholic Charities, and her contact information is at the bottom of the slide, to set up another process. They take, some shelters are doing daily emails from the shelter manager about bed availability. There are other ways, so if that would work better for you, please let her know. The other thing is that we just also need to reiterate that our shelters need to be accepting referrals 24/7 and including weekends. So please make sure that someone is available to answer the phone and to accept intakes at all times, especially with the current the current shelter capacity for single adults. Catholic Charities really relies if they have somebody waiting for shelter and you call and let them know that you have a bed available in the second shift, that allows them to get someone in, right away. And so it is a lot of work. We do recognize that it is a challenge to operationalize some of these things, but this is literally how we're working to get people into available beds as quickly as possible. And then just a reminder for our family shelters, the number of family members that need to be placed might not exactly fit the number of beds you have available. So especially for those of you with single rooms. So for example, a family of 4 might need to be placed in a room that has 5 beds. Obviously, we would like to, maximize the beds, but we also do need to take the opportunity, if we have enough space, to bring families in as they need assistance. And one thing that I didn't say when I shared the bed availability that I think is important for the community to know is that right now our family bed capacity is okay. We have regular availability within our family shelter system. The single adult system and the DV system are, very, very close to capacity much of the time. So that's really, all of these steps that you take in working with Catholic Charities is just helping us get people into shelter quicker. Next slide. You may also receive shelter placements directly from the DFSS Homeless Outreach and Prevention, or HOP team. And they are, and also sometimes from outreach providers who are doing placements with Catholic Charities. In both of these cases, Catholic Charities will contact you to make the referral, and the client will be transported by the HOP team and have a HOP team intake to confirm the placement. If an outreach provider that's not the HOP team is making the placement, they will still contact Catholic Charities. It's depending on the outreach provider's capacity to transport. They will either transport the client, or Catholic Charities will come and pick up the resident for placement. But the thing that will be the consistent thing for any of these placements that are coming from people working with people experiencing homelessness who are unsheltered will be that Catholic Charities will still contact you. So you can still expect a call about the placement, even if the transportation and the person doing the dropping off is different. Next slide. So I'm going to take a pause here. I'm going to turn this over to Dr. Jessica Herrick, who is now working with CDPH, who is going to talk about, wrap us up a little bit to talk about COVID fatigue and the recent stay-at-home advisory. And while Dr. Herrick is speaking, I will review to see if there's any questions, and we'll come back. So if you have any questions about what I just presented, please put them into the question box. Dr. Herrick?
Okay, I hopefully should be unmuted now. Can people hear me?
Yep, I can hear you.
Great,
Yep.
Okay. So lucky me, I get to talk about how exhausting COVID-19 is. So I think that this is a really important topic, quite frankly, that's having a big impact right now, is that everybody is just exhausted by this point. So I think everybody's feeling the sort of compounded stress and exhaustion of the fact that we've been staying on alert, and it's now gone on for like 7 months. I think people are getting tired. They're tired of being so anxious. They're tired of being careful all the time. They're tired of, feeling that they have to, wash down their groceries and wash their hands. And so I think the fatigue is really setting in, and having unfortunate sort of effects. So especially kind of with winter approaching, people are going to be staying indoors. And so I think that kind of gives us now, I think, is the time to sort of try and take a breath and sort of like refocus and sort of recommit to these efforts, because winter, I think, is going to be a tough time, because people are going to be staying indoors, and so they're not going to be able to do like what we did in the summer, where you would just meet outdoors and wear a mask, etc. So I feel like, and I say this all the time, that it really feels like we're sprinting a marathon. So we started out with a sprint, and now it's turned into a marathon. But there are some things I think that can be done to help cope with this sort of fatigue and exhaustion. So one is to sort of recognize amongst ourselves that this fatigue can unfortunately have the sort of side effect of making people a little bit more lax, a little bit more careless. And I think to recognize that and really sort of focus in on that and try and emphasize to people that that now is the time to really stay vigilant. You know, our shelter staff are essential workers. They're the background of our community, and it's essential that they stay safe and healthy. And of course, you know, the shelter staff also live outside of their community, outside of their work in the community, where our numbers are kind of, we see them going up and up. So then there's sort of a double risk for them. And at times they can even be the one who bring the COVID exposure in from the outside. So I think there are some tools for coping that I think should be kind of emphasized right now: coping with stress and exhaustion, trying to encourage people to do exercise, to talk, reach out to friends. You know, just because you're sitting alone in your house doesn't really mean you have to be alone. That's one of the great things about technology, right? So I can be giving this talk from, you know, from my house. And I think even just a phone call with a friend can sometimes really improve people's mood. I think the other thing is to sort of remind people that their sacrifices are not worthless. So they are making a real impact on helping to stop this pandemic and helping to stop the spread of this virus. So the kind of the things that they're doing to socially distance, kind of the suffering they're going through is not without, it's having an impact. And so it's not that they're doing that for nothing. I think the other thing is to really kind of remind people that they are sprinting a marathon, but the marathon is almost over. So I think we're getting close. Within the next 6 months, you know, we should have a vaccine out. We now have some monoclonal antibodies that are showing benefits. So I think even though it doesn't feel like it, the end probably is, I think it's in sight. It may be far away, but it's definitely within sight. So another thing that's been sort of important throughout the pandemic is making sure that we clearly communicate with staff and communicate expectations. So we, you know, have always sort of focused on working with the staff to try and reduce the odds that the staff themselves might introduce COVID-19 into the facility. And so I think, especially given the numbers that we're seeing, you know, it's really important that staff understand that even when they're not at work, they still should be following these best practices. So washing their hands frequently, and that they know how to wash their hands, that you wash for 20 seconds with soap and water, you wash the back of your hands and in between your fingers as well. That people really try and stay home as much as possible, and avoid close contact with others. I mean, it's funny, my 4-year-old daughter was playing with her Barbies the other day, and she was saying they have to be 6 feet apart. So that's one of the important things as well, is that social distancing. And then when they're out in public, in a grocery store or wherever, that they wear cloth masks, and also that they clean and disinfect frequently touched surfaces daily. So doorknobs, light switches, phones, faucets. So all of those things are sort of best practices to keep them and our community healthy. And those are important to do when they're not at work as they are when they are at work. And then finally, and this is a very tricky one, especially where I work, which is letting people know that if they're sick, they really should stay home, except to go, obviously, to their doctor if they need to, or to get medical care. And I think that's one that's very challenging, especially, you know, amongst healthcare workers who tend to be kind of type A and are very, very hardworking. But I think that is absolutely crucial, that if people are not feeling well, they should stay home. All right, so next slide, if you could. And so this is, you know, this is going to be very, very challenging, is that as the holidays come up and our numbers are so high, it's really, really important to still practice, you know, these infection control and preventive measures. So, you know, the virus doesn't care that it's a holiday. So, you know, you think, I just want to get together with my family, it's Thanksgiving. But the virus doesn't care that it's Thanksgiving. And so I think, you know, it's a very, very hard thing to say. It's a hard thing for people to hear, that saying, you know, don't have gatherings in your house with anyone outside your household, you know, even with family and friends. But I, you know, as sort of painful as that is, I think, you know, the way I think of it is that I'm okay giving up one Thanksgiving with my parents if it means that I can spend hopefully the next 20 years of Thanksgiving with my parents. So, you know, I think if we try and sort of encourage people to frame it that way, as the end is almost in sight, we are almost there. I do think that within the next 6 months, you know, with these vaccines and the monoclonal antibodies, we're going to get control of the pandemic. But right now, we're not in control. So we're encouraging people not to travel. If travel is essential, then they should quarantine. And you know, this is one thing where at least we do have the technology we have nowadays. So, you know, they can Skype or use Zoom or whatever they have to, you know, video or phone chat with their friends or families. And I know that this is a very tough message to sell to people, but if you think about it as, you know, my grandfather, you know, was involved in the invasion of Normandy, and I'm just being asked to not have a Thanksgiving celebration, you know, so it is a sacrifice. It's not, you know, something that we take lightly, but it's still, you know, this is something that's doable that I think we can all do. And that's going to pay off. That's going to save lives and help people. Are there any questions?
I'm not seeing any specific questions. There is a question, but it's going to be covered in the next slide. But I do think, Dr. Herrick, you know, the mayor also issued a stay-at-home advisory, and you know, our shelters have been asking some questions about that. So I'm also going to encourage our providers, if there are questions that you have about that, to please put them in the chat, and we can take them back to the CDPH and the work with them and your shelter-based service teams to get some answers on that. But if there's anything you want to say specifically to that, Dr. Herrick, that would be great. Or if you just want to wait until you get the questions.
Yeah, I don't know that I have anything specific to say, about that.
Okay, so if you have any questions, please put those in the question box. And I know that CDPH is planning to issue some additional information. So we'll continue to communicate that out. Thank you so much, Dr. Herrick.
Thank you.
So I saw in the question box there was a question about funding opportunities, and for our DFSS funded shelter programs, we are in the process of finalizing some funding that we do have available through the CARES Act for shelters to support COVID response activities. I do want to say it's a it's a limited pool of funding, so we hope that it will be helpful in supporting any of your staff supports, supplies, PPE, and the things that you're continually needing to sustain during this time. So we'll have more information about that as those get finalized. I also, at the bottom of the slide, Mary Kate wanted to share out an additional PPE resource. This group has supplies available, and you can reach out to the Gmail address that's listed on the bottom of the slide, and it's a first come, first serve opportunity, but they do have a significant amount of masks and things like that. So we wanted to just make that available to the broader group. And that concludes the webinar, our actual slide material. Please, as I said, feel free to put questions into the chat, and I think we can leave this open for a few minutes just to have the opportunity to capture any questions that you have. Please feel free to continue to use the DFSS-homeless email address to contact DFSS about any questions. As we have throughout the pandemic, we'll continue to be in conversation with CDPH, now our shelter-based service providers, and all of you. And we will continue to share out information on the webinars that we do jointly with All Chicago and the COC. The next one is December 4th. So, I hear and we very much take seriously the importance of consistent communications. And so we'll continue to use a lot of these opportunities to get the information out to you. So really just thank you all so much. I think the marathon analogy is so real. We've been in this for a long time. It is hard to think about holidays that aren't normal. And the work that all of you are doing to keep some of our most vulnerable, residents safe and safe through the holidays, and getting them back into housing as we work together is so critical, and can't thank you enough. So really, thank you for being partners in this, for supporting the connections to shelter with paying attention to the bed availability and the bed reporting, and working with Catholic Charities. And we will continue to be in contact. Thank you so much.